Treatment started about 6 months ago when you were first diagnosed with this cervix cancer. At the time, you had just delivered a baby, and I believe at the time that we first met, your newborn baby was 10 weeks old. And on a follow-up appointment, we had found that there were some abnormal cells in the cervix cancer. This ultimately led to the diagnosis of cervix cancer, after which you embarked on a fairly long treatment. This is the CT simulator, and we're going to be just taking some scans of you today to prepare for the future radiation treatments you'll be receiving. Well, the purpose of doing this is basically to take a scan of your abdomen and of your pelvis. And what we'll do at that time is, you've already had surgery to remove the cancer, but we're trying to give radiation to basically where the cancer used to be. And what we're going to do is we're going to visualize the lymph nodes of the pelvis. We're going to visualize the tumor bed, or where the cancer used to live. But at the same time, we're going to need to visualize the bladder and the rectum and the small bowel and the ovaries, which you still have in place, and basically create a customized treatment field with beams coming from multiple angles of the body to try to pinpoint focus the beams right there on our target area, while making sure that our normal structures are well protected. And what we're doing now is we're putting your legs into this, what we call a vac bag. It's basically an immobilization device to keep your legs in the same position on a daily basis. We will be using this bag every day during your treatment to make sure the legs are in the same place, therefore the pelvis is in the same place. And we're going to let you hold this ring just so you've got somewhere to put your arms and it stays nice and out of the way of our scanned area. This ultimately led to the diagnosis of cervix cancer, after which you embarked on a fairly long treatment. And out of the 7 lymph nodes that were removed out of your pelvis, 1 of the lymph nodes did have involvement of this cervical cancer. Because of this, after the surgery, your doctors had recommended some treatment with chemotherapy as well as radiation, basically to try to sterilize out the pelvis and actually the lymph nodes of the abdomen as well.
Shortly thereafter, I started my radiation therapy. I had 6 weeks of chemo on top of that, once a week on top of the radiation. I had, prior to starting out, when we had to go through the simulation and the mapping and all that, and laying there on that table, not knowing what was happening, I had all these, emotions of fear and, just not knowing what to expect.
And Patricia, this is the treatment table, and this is the linear accelerator that will be used to deliver the high-energy photons into your pelvis to eradicate the cancer. We've got 2 specially trained therapists here that are going to help us with the daily setup, and they're going to help position you in the exact, correct, precise position on a daily basis. And they're going to be the ones that will administer the treatment on a daily basis. Okay? So if we can have you go ahead and lie down. And right now, Patricia, we are still using the same device here that will immobilize your legs so that we can reproduce your treatment on a daily basis in the same position as we did earlier at the time of CT simulation when we took those images of the pelvis. Okay. At the very end of this, we also gave internal treatments to you. With vaginal cylinders, in which we placed a device into the inside of you to basically give some direct radiation to close to where the cervix used to be, which was the area that we were a little bit concerned about based on the surgery that had been performed originally. And all in all, as I understand it, you've done very well with treatment, and we're now finished with treatment and it's behind us.
Behind us, and I got my clean test today, matter of fact.
Excellent.
That it came back normal.
Tell me more about that.
Well, I went in and I had a CAT scan, and I received my results, and my results were that it was normal. And I received my PAP results, and I also came back normal with that as well. So I'm excited about that.
Can you tell me how the treatments were for you? Did you tolerate them okay?
I did. The first 25 that I had done to the pelvic, I really did not have any symptoms at all. I was told to be aware of, you know, maybe possible diarrhea. I had really little to none at all symptoms, period. But the next 25 that I had up to my upper torso, I did experience just not wanting to eat, a loss of appetite. And really that was the extent of the symptoms.
I see. It's very gratifying to hear you say that, and I'm glad that the people of Polk County can hear a lot of this, because I think the idea is that some people think that with the treatment of cancer, they're going to have, you know, bad nausea, they're going to be throwing up all the time, they're going to be very sick, lying in bed, can't get up. They have these visions of what treatment of cancer can be like.
I had those visions.
And you had those visions
I
as well.
did.
Yes.
So, and you know, the fear of the unknown was there. And once I went through it and experienced it, you know, it wasn't what you think. It was, I wouldn't say it was easy, but it was definitely doable.
So it sounds like the apprehension or the fear came from not knowing what was going to happen, or maybe stories or things that you had heard that could happen to people.
A little bit of everything. Hearing people's stories, reading on the internet, which I did a lot of my own research, which is good and it's also bad because you find some really scary things out there. I am doing completely normal, fine, functioning like I had never gone through this before, you know, back to my old self, back to exercising and taking care of myself and taking care of my 3 boys and doing very well. I have a wonderful husband, and I have 3 very young children, a 9-month-old and a 3-year-old and a 6-year-old. All boys.
Many people think that after the diagnosis of cancer, that the treatments can be very difficult, and they think that life after treatment can be very difficult. But in your case, you've just told me that you've got a husband, you've got 3 young children, you're a stay-at-home mother, a full-time mother, and you're able to very adequately and exceptionally probably take care of your 3 sons without difficulty, without issue.
That is correct. Right after treatment, I experienced, you know, fatigue, and it wasn't long afterwards that I was feeling back to normal. Once my hemoglobin came up, I was having some issues with my hemoglobin being real low and had to have a blood transfusion. And once I had that, it was like night and day. I felt completely normal and was able to bounce back and get right back into the swing of things. I met wonderful people, wonderful doctors, wonderful nurses, just everybody in general, and you know, just going on a daily basis to radiation and being in that waiting area for my daily appointment. You know, I met wonderful people, and you know, we had good times and shared great stories. If I was to give any advice to anybody that has received a cancer diagnosis, I would say, don't be afraid. You know, you're going to have fear. That's completely normal. But having gone through it, it's not that bad. And look where I am today. I am a couple months out of treatment. I am healthy. I am happy. I'm living life as normal as it was prior to the diagnosis. And having not had the treatment or, you know, the support, the doctors, you know, life would be completely different. I would not be where I am today.